Kind of,
Thank you, Mary.
when you combine all these surgeries, how much does it improve the vision?
When you combine surgeries, there is a reason for that. While we are getting William over, but what we'll talk about is a combination concept. If you see the eye model we have,
Let me get this out
what
for
happens
you.
is you look at the eye, you think about it as a structure where, that's fine, I'll just use one half so we can show
Of
the
course, I
audience.
can't keep it together.
So that is actually your normal cornea.
Come on up, William.
William, come on up. You can give me some other cornea pieces from there, okay? So this is a normal eye. I'll just go through this system so this way it'll kind of summarize everything we've discussed today. Thank you so much, Karen.
Sorry.
Yeah, no, you're fine. It's perfect. So let's just summarize this for the audience who are joining us now. This is a normal eye. In a normal eye, the cornea is dome-shaped. This is what happens to patients with keratoconus. The cornea becomes cone-shaped. So if you see this on the palm of my hand, it becomes very clear what we are showing here. This is a keratoconic cornea.
Yeah, this is coming to a point, and you want it to be
Exactly.
rounded.
So you can imagine a contact can't sit in, plus they're looking through a kaleidoscope. Now, combination surgeries we discussed, for example, in Mary's case, her natural lens in the eye, we took advantage of that being a cataract, and we kind of corrected that lens, which is, everybody knows a cataract is a cloudy lens. So we removed the cloudy lens, put in a special lens inside, which had toricity or astigmatism, and it fixed her. Now, take combination technique where someone like William, being in the medical profession, he already had Intact surgery, else I think Maryland, Virginia, if I remember.
Virginia.
Yes. He had it there, and the surgery went well, but it had no good outcomes vision-wise. He had the Intact surgery.
Okay.
So what we did in his case is, instead of removing the rings, we did advanced laser surgery on top of it. So we corrected the residual astigmatism that was left behind beyond the Intact, and you see him, he's without glasses.
Tell me a little bit. What was your vision like before, and what's it like now?
Well, I used to wear contacts. One morning I woke up and everything was sort of distorted, so I figured I put the contacts in the wrong eyes. So I changed them up, still distorted. So I went to the doctor and said, hey, something's wrong here. And after a little while, I had a whole lot of people in the room looking at my eye, and I was like, what's going on? So they told me I had a condition, keratoconus, which I've never heard of, sounded real bad. So I did a little information gathering myself, found out about it. So over the years, they sort of just watched it, and it progressed and got worse. So, you know, one of the doctors told me about this new Intacs thing. So I went to Virginia, had that done. I was in the military. You know, it got a little better, but not enough for me to really notice anything. So I was seeing an optometrist out in town. He suggested Dr. Gulani. He said, if anything can be done for you, this is who you need to see. So I was like, hey, what's the worst I have to lose is my eyesight. So went to see Dr. Gulani, and he talked with me and my family, told me what I could expect, and he told me, hey, it's not a lost cause. We can make it better for you. So I was like, okay, I'm willing to try it. And, you know, he set me up for the surgery. I was really apprehensive about it. But once we did the surgery, I was like, wow. I mean, just one day after leaving, I was like, this is really strange, because now I could actually see individual blades of grass, which I was like, I knew this is the grass down here because it's green, but now, I mean, I could actually see bugs in the grass.
Were you surprised you could actually have a different type of surgery even though you had the Intacs?
Yes, I was real surprised when he told me he could do something else. I was like, well, you know, your eye is only so big and you can only do so much to it. But he was like, he assured me, he said, you know, we can help you. You know, there are ways out there. It's not a lost cause. And I was like, okay, well, let's just see what happens and go for it. And, you know, it was probably one of the best decisions I ever made. And I'm really glad for it, because it changed a lot of things for me.
Thank you so much for being here today, William. I appreciate it. And I think that is important for people to know, is that there is something else that you can do if the Intacs don't work, or like in William's case, you need something else done to see perfectly. You can provide that, or those options are out there.
Again, if you approach the eye or the vision as an art, you can always do things to arrange the optics to make people see, yes.
Well, thank you so much. That's about all the time, unfortunately, we have for today. As you can see, a lot of people do have questions about keratoconus. It is something that is out there that people do want to know more. And if you have any questions, you can contact Dr. Gulani directly at 904-296-EYES. The information, of course, is up on our screen, and you can also email your questions to gulanivision@gulani.com. And we will be back here again next month on November 11th at 12:30 p.m. We're going to be talking about surgical options to avoid reading glasses, and that is sure to be a hot topic for a lot of people, because nobody wants to have those glasses. Thank you so much for being here today, and we'll see you next month.